Hi, I'm Kandice.
And I'm Katy.
And today we'll be talking about Psychoeducational Psychotherapy, or PEP for short. PEP is an evidence-based psychosocial intervention that was developed by Dr. Mary Fristad and colleagues specifically for children 8 to 12 years old who are struggling with bipolar spectrum disorders. In fact, this is the only evidence-based treatment designed for pre-adolescent children with bipolar spectrum disorders or complicated depression. Generally, people get referred to this treatment for a variety of reasons, but the primary reason might be because your child has been diagnosed with a mood disorder or is suspected to have one, and you and your family have been experiencing great difficulty in figuring out how to support your child, how to communicate with them, and are helping to manage their intense mood symptoms. The good thing is that PEP is designed to target these problems and much more, so you'll be on your way to helping your child successfully navigate and manage symptoms of their disorder. You might be wondering to yourself why you'll be involved in a therapy process when it was your child who was diagnosed. Well, the fundamental principle of PEP is that it's not your fault, but it's your challenge. Although the cause of mood disorders is often biological in nature, the course of the disorder is heavily influenced by life stress, family relationships, and daily events. So the focus is to educate and work with both your child and you. Families who have participated in PEP report experiencing a variety of benefits. For example,
for primary caregivers, PEP provides information about different types of treatments, including biological, psychological, educational, and social treatments. It provides guidelines for how to establish a mental health treatment team. It helps to increase understanding of how school systems work for children with special needs. It helps you learn how to develop your child's school team and how to work with them effectively. It also helps you become better consumers of the mental health system and access higher quality services. For children, PEP helps learn techniques to identify and manage difficult moods. For primary caregivers and children, together you and your child will learn coping skills such as problem solving, how to communicate better and more effectively, crisis management skills, and how to recognize and prevent or change negative family cycles.
there are two types of treatments within PEP. One is called individual family, and the other is called multifamily. Katy here will talk more about multifamily. But the primary differences between these two treatments are that
for individual family, it's conducted with the individual family and not a group of families. There are 20 to 24 weekly 50-minute sessions. The sessions alternate between parent and child sessions. Some advantages of this format include more thorough coverage of therapeutic topics, flexibility in scheduling session times. There's also 2 child sessions devoted to developing healthy sleep, eating, and exercise habits. It includes a session specifically for siblings and includes a unique parent session where the parents and therapists meet with staff from your child's school. For multifamily, it's conducted with multiple families in a group setting. There are 8 weekly 90-minute sessions. The parent and child sessions occur at the same time. For the parent session, there's one therapist with 12 to 16 primary caregivers, and for the child session, there are 2 therapists with 6 to 8 children. Some advantages of this format are that parents have the opportunity to hear multiple perspectives, so families can learn from each other and from the therapist. Children have increased feelings of acceptance and peer support because they will be around other children that have similar problems, and children can practice newly acquired social skills.
if you think individual family PEP is a better option for your child and family's needs, to find out more information about the therapy, you can go to www.cebc4cw.org. A link will be provided in the description box.
I'm going to give an overview of what a typical session for the children and a typical session for parents look like. Generally, the kids will meet for their session at the same time that parents meet for their session. The session has two main phases of treatment: the psychoeducational component and the component involving cognitive behavioral therapy. I will start by describing the kids' session. The first 10 minutes is combined with parents and children. During this time, families check in, and then everyone will discuss the family take-home project from the last session. The groups then separate. The next 10 minutes is spent by having each of the kids share their feelings through identifying and rating feelings and telling one or two important events that happened in the last week. The majority of the time is spent on the 40-minute lesson of the day. The lesson will typically include exercises and questions centered on the content for that day. Children are encouraged to participate in this safe environment with the support of their peers. At the end of the lesson, kids get the chance to practice what they learned and are then assigned their take-home project. For 15 minutes, the kids play group games and engage in exciting activities to help break up the time and work on social skills in a fun way. The next 5 minutes, the children have breathing exercises to help them calm down before rejoining their parents for the remainder of the session in large group. The session comes to an end with a 10-minute review involving the kids and parents. 3 kids volunteer to teach the parents about the lesson of the day, describe the take-home project, and demonstrate the breathing exercises that they practiced. The parent session is a very similar format to the kids' session. The first 10 minutes is combined time when parents and kids check in and discuss the take-home project from the prior week. Parents and kids then break up into their separate groups. The next 10 minutes is spent reviewing the parents-only take-home projects. Following the discussion of the projects is the 60-minute lesson of the day based off of the topic for that particular session. Towards the end of the session, parents are assigned new and ongoing parent-only take-home projects. The final 10 minutes is the combined time with parents and kids, where kids teach the parents about the lesson, take-home projects, and breathing exercises.
Each session has a specific focus and goal for kids and their parents to learn. I will give the brief session breakdown of content of kids and parents so it is clear what areas Multifamily Psychoeducational Psychotherapy works on. Session 1 is introducing psychoeducational psychotherapy and addressing any questions or concerns about the therapy. Next, the therapist will talk about symptoms of depression and mania that the child is experiencing. In the children's session, they will help the child learn how to recognize and rate their own mood symptoms. In the parents' session, the therapist will talk about the importance of psychoeducational psychotherapy and how the take-home projects are applicable ways of developing solutions and applying newfound knowledge in between sessions. Session 2 for the kids session works on helping the child separate symptoms from self to see symptoms as a separate entity rather than qualities of themselves. The kid will be taught about treatment, the treatment team, and their role in treatment. Finally, the kids will be educated about their medication and the role that plays in treatment. In the parent session, parents will be educated on how to use cost-benefit analysis to make decisions about medications for their child. Next, the therapist will talk about different medication used to treat mood disorders, including their classes, symptom targets, and common side effects. Session 3 helps the child recognize body signs that they are feeling strong emotions, identify triggers for difficult emotions, and learn coping skills to handle these strong emotions. In Session 3, parents are given an overview of the mental health system, ways to access different services, and the range of various mental health care professionals. Parents will also be given valuable information about services in the school, recognizing different people within the school system, and how to build a coalition within the school. Session 4 teaches the child the difference between helpful thoughts and hurtful thoughts, and how these thoughts can affect feelings. The child is then taught how to use their thoughts and actions to manage their difficult emotions. Parents learn about how negative family cycles may play out in their own family, how their thoughts, feelings, and actions interact in the context of negative cycles. The therapist talks about how to shift to more helpful thoughts and actions to improve the overall functioning of the family. In Session 5, the child will learn steps to problem solving and how problem solving strategies can be used to navigate daily challenges. Parents also will work on problem solving skills, and the therapist will help parents improve their coping skills. In Session 6, the child will work on their understanding of communication and learn steps to the communication cycle. The therapist will also help the child increase their awareness of nonverbal communication. Parents will work on improving communication within the family and identify hurtful communication to replace it with helpful communication. In Session 7, the therapist helps the child recognize components of effective communication. The parents will work on developing strategies to manage mood symptoms, plan for crises, and develop stress management strategies. Then finally, Session 8 focuses on any questions or concerns of the children and parents and reviews any important lessons.
You're probably thinking, okay, all this information sounds really good, but does this therapy actually work? Research has shown that severely impaired children have benefited from multifamily PEP. It's been associated with increased parental knowledge of symptoms, improved family interactions according to parents, increased perceptions about parental support according to children, decreased severity of mood symptoms, and decreased behavioral symptoms.
One very important question to ask yourself is, what are the main problems that I'm looking for help with? If you can answer this question and believe PEP might be right for your family's needs, there are many links you can use to try to find someone who offers this treatment near you. Depression and Bipolar Support Alliance,
APA Practice Organization,
Wyoming Association of Mental Health and Substance Abuse Centers,
American Association for Marriage and Family Therapy.
You can find these links in the description box. There are several questions you may wish to ask potential providers.
Are you licensed to practice therapy in this state?
Are the other therapists who will be working with my child licensed in this state?
Have you received training in PEP? Do you offer individual family or multifamily therapy?
How much experience do you have with this therapy?
What is your success rate with this therapy?
What are the risks associated with this treatment? How can I recognize problems if they occur?
Can my family and I meet with all of the therapists who will be involved in treatment before we begin?
What options do I have to pay for treatment? Do you offer a sliding fee scale?
How soon can we begin treatment?
Will treatment progress be monitored? Who will do this and how?
What can I do if I don't feel this treatment is working?
After treatment ends, what comes next?
We hope this information was helpful.
Thank you for watching.